We're on? Okay. So, welcome. And wonderful to partner with you one more time, Kate. The reason that, it's not the reason I'm here, but the presentations will be from here and be recorded because part of the requirement for graduating with an MPA is to do a portfolio. And so a lot of the students are planning to include this project in their portfolio. So the presentation is their way of putting it in their portfolio. And then after the presentations, we'll turn off the recording so that the discussion can be more free-flowing and not be recorded. And the only purpose for which they're recording is just to put it in their portfolio. So everything is, we understand the confidential nature of what we're doing here. So I would like to say that you're the judge of the product and how good it is, and we look forward to hearing from you and your feedback and candor and all of your staff. But this group of students has impressed me, and I want to just share with you why. There are 6 of them. One of them is in Rhode Island with a sick family member. Between the 6 of them, they've had hospital emergencies for most of them, deaths in the family. One of them bought a new house. A couple of them have had personal illnesses, business travel. The only thing they haven't done is any holiday travel, but honestly, the class has just sort of marched forward, and I've never heard an excuse like so-and-so isn't here, so-and-so. Everybody's covered for everybody else. And honestly, it's just been impressive. It's been impressive for me. And this week, they were finalizing their project, so they decided that they need to meet for 2 hours on Wednesday evening and 4 hours on Saturday, and that was not my suggestion. It was their own thought. So the other thing that is noticeable about this class is I think some of them are from the Show Me State, because you could sit there, or if I sit. Okay, good.
Sorry. Oh, it is on. Good.
Okay. So, perfect. So, the first class, Kate, I showed them our nice brief that we had done. And they say, well, that's great, Dr. Eckhoff. But the first thing they did when they started putting their information requests together is, like, show us what you actually did, you know. And so they're like, it's been very candid and straightforward. And I find it, you know, they've been very self-motivated in that respect. So, and also just to acknowledge that Cecily Rodriguez came in and spent an hour with us as well. So, you know, she's brought a nice perspective to the class as well. And with that, if we could just go around the room for a quick introduction by name, and then we'll turn it over to the class to present. Okay, Shelley, do you want to start off?
Sure, Shelley Sugarman. I've been the Virginia Tech liaison to the city the entire time, so thank you so much.
Andrew Worrell, Sean Stein.
Kristen Lake, Jay Wood,
Katie Leonard,
Hank Harvey.
Allison Coleman, Lisa Gilbert, Esperita Below.
Okay, well, it's nice to have you all here. And I'm going to turn this over to Shelley.
So I heard from Jared, so that's so I heard from Jared.
Good evening, everyone. Again, I'm Shelley Sugarman. I've been Virginia Tech's liaison to DCHS for this semester. I wanted to first thank Ms. Garvey and your staff, Esperita, Allison, and Katie, for all of their help throughout this entire process, and also for being here after hours to accept the brief and to hear more about the content of our report. This project has not only provided DCHS with hopefully a way forward for developing their equity program, but it's also provided us with experience in engaging with local governments. with determining the needs of a client, with preparing a deliverable for a specific audience, and also balancing client needs with, against specific constraints that we might have had. Our report is structured as an executive level document outlining the first few steps toward the development of an equity program. We approach the equity issue by recommending steps to DCHS to follow, for you guys to follow, such as diagnosing the equity problem. We have a graphic here that we'll be walking through. Each of us will be presenting a recommendation based on these following steps, where you first define equity, identify the equity problem, identify and close any performance gaps that you might find, and then develop a citywide approach to equitable service delivery, which is the end state is having an entire program that you can work with. Our presentation will follow this framework as we move forward. Each member of the class will present a recommendation, and at the end of the presentation, we're going to open it up for discussion and hopefully feedback from you on ways that we could have gone a different way, or things that you liked, and then how you plan to take these and move forward with what we've recommended. So for the first presenter is going to be Sean Chang. He'll brief you on our equity definition.
Okay, so my task with this project was to, well, this is something that the group came up together with. So before we get into developing any kind of recommendations for identifying equity problems in DCH programs and address issues, was first and foremost we had to define equity, and that's something that you guys brought to us during the initial meeting. So we took a look at how equity was defined elsewhere, including community and health programs at local, state, and federal levels, international organizations like World Health Organization, countries other than the United States, such as Australia in particular, and took a pretty close look at public administration literature to see how they define equity. So our research resulted in the preliminary definition that we sent to you as part of our interim report, which you guys reviewed and provided feedback to us. And some of your recommendations were to contrast equity and equality, emphasize that in order to achieve equity, some people may receive resources and support that others do not, and in particular to pay attention to highlight legally protected classes, race, religion, sexual orientation, age, etc. So we took this feedback and modified the definition that we provided to you in our interim report to the following here, which is in the report that we sent you. Have you guys had a chance to review this? Okay, so in that case, I won't actually go into reading this. So we recommend this particular definition of equity, and to make this publicly available on the DCHS website, and also any kind of printed materials that deal with equity. Particularly because when we went through the DCHS website and looked for equity and to see how DCHS had defined equity, we came up with, I think, 10 pages that discussed equity explicitly in three documents. And this, of course, isn't going into equity as it relates to finances or home equity or stuff like that. So if you want to increase equity or bring attention to equity and how DCHS is moving forward with that, you want to make that visible to both DCH staff and also to city residents. Okay. And you'll notice that this definition doesn't explicitly differentiate between equity and equality. We do understand that that contrast is important, but we didn't want to include that in the definition itself because we felt that it would lead to unnecessary controversy or confusion both among DCH staff or city residents. And we recommend that the definition of this particular definition stand as is, and any kind of clarification between equity and equality be provided in a different format, such as equity training programs for city staff, town hall meetings, basically kind of venue where people will be able to ask in-depth questions and you'll be able to respond accordingly, instead of just have, I feel like this definition is already fairly lengthy and we don't want to go on and on. Some cities around the United States that have good explanations of how equity and equality differ. Kate, I think you brought up a couple examples: King County and Tacoma in Washington, Burlington, Vermont, Portland, Oregon, San Francisco Public Health Department have good working definitions of how equality and equity differ. So that's just something to, if you guys want to take a closer look at that. Okay. Let me go back, and I'll, Andy, it's up to you.
This was, in identifying the equity problems, this is really what it does is it provides an explanation of the toolkits that we found were available to assist in the dynamics of equity across the broad spectrum, those being gender, sexual orientation, racial equities, which was pointed out in the Global Alliance on Racial Equity, which was really, as they've indicated, that is the guide on. That is the, I guess, what you would call the Sentinel program, and that's the one that they offer national and regional outreach programs for. However, going back to that definition, or at least referencing it, because there's so many different dynamics with equity, we did want to take a look out to see what else was out there, and we found some really, really good programs that were at the federal level, and so we wanted to point those out. The first is deals with actual healthcare issues, and that was the Hospitals in Pursuit of Excellence. They have an actual healthcare equity toolkit that they provide that's fairly robust. It's 151 pages, and what it allows you to do, or allows a user to do, is actually work through your program to see where those gaps and challenges, inequities, are, where they are. And it's based on, really, there's three primary steps: increasing collection and use of racial, ethnicity, and language data, increasing cultural competency and training, and increasing the diversity of leadership at the governance level. And those are going to be, through these steps, or these three programs, toolkits that are provided, that's a recurring theme. The second one is the U.S. Department of Education's English Language Learner toolkit. That too is a fairly comprehensive manual that talks about the programs that are available and how you can, again, identify those equity gaps, and then work those, as the GARE manual points out, actually work them into your programmatic processes and to embed them in delivering equity capabilities so that they can be nested with and measurable as outcomes. There is another one that we'd like to present, and again, I don't want to go too much into the GARE manual or into the Seattle's toolkit for racial equity, but the U.S. Department of Education is now producing a toolkit for career and technical excellence for women. And that's a new aspiring toolkit that they're currently developing that you'll see in some of our research. Across these four programs, you'll see that data usage, training, equity issues incorporated, integrated, and linked into these embedded processes, performance measures, setting goals and monitoring, and then also collaboration, communication, and exchange of information were the common themes amongst all of these toolkits. And to expand a little bit more on the performance metric side, Kristen, I think, is going to explain. Oh, as I was, Jane, I'm sorry.
I have researched a couple of examples on how to close the performance gaps on health literacy and language access. So for health literacy, it basically means to a degree for somebody to understand basic health information. That includes understanding the instructions on a medication bottle, for instance. And so what I found is a no-cost training provided by the CDC, National Education Association, and World Education. And I believe that these free training are very actionable, that your staff could take on easily, and you could just do that tomorrow and get it out of the way. It's no cost. So for language access resources, So there's a service reimbursement program from Virginia Senate Joint Resolution 122, where DCHS submits their interpretation their translation services under administrative claiming for Medicaid patients only. DCHS should look into contracted services vehicles provided by Department of Health from the state of Virginia. DCHS should look into available translated materials from the CLASS website. CLASS stands for Culturally and Linguistically Appropriate Service. I have browsed through that website, and there may be like more than 10 pages of several documents you could look into, and you could modify it to fit DCHS services. Last but not least, DCHS should local partnering with other local agencies like Fairfax County or Arlington County for rare but low demand languages. Maybe not Chinese, not Spanish, but Mongolian or some very rare from, I don't know, not Spanish, not Chinese. So that's just a way for you to be more efficient and focus on your mission. So.
So you've taken the toolkits, you've applied some of your current policies and your procedures into each of those toolkits to see where you have equity gaps, whether you need to apply these training opportunities or translation or other services to those gaps to resolve the gaps, the performance gaps you have. Whether it's, and we want to make clear is that this can be internal gaps, performance gaps, or external facing, like customer service gaps that you might have. You can apply both depending on whether the policy is going to extend to the public when you issue your services. So you identify your gaps, you close your gaps, and then there might be a chance that DCHS really doesn't have an equity issue, and it might just be more of a process issue that you have with maybe some of your benefit application processes, or maybe it might be a messaging issue where a lot of people just don't know what the processes are, or you might have one customer that then they're both friends, two customers and they're friends. One got a certain level of service, the other didn't, and they thought there was a disparity there, when really it was just one customer service agent didn't know the process and was completely different from what the other person knew. Whereas you've probably identified exactly what the procedure should be, but yet either there's a lack of training or something else that's causing each of them to operate separately or differently and not consistently across all of the, for all the customers that you might have. So once you've determined if there is a process issue, then the next step is to develop your, you identify your gaps, you close your gaps, and then start developing an entire program after you've had your training for all your staff, and now you're ready to actually be public-facing with this and stand up an entire program to improve your citywide level equitable service approach. So Kristen is going to talk about the entire program approach.
I'm going to close it all. So we referred, at least in the report, to the GARE report, of course, to actually have a holistic approach to developing your equity program. I'm not going to rehash what the GARE program says. But we did say that you guys should develop performance indicators to track your overall program health. So Andy found some good resources, and the one was actually using one of your city's tools, which is called AlexStat, which I'm sure you're familiar with. And the other is the Illinois Department of Human Services and the GARE report reference the accountability guide, and it assists in establishing measurable outcomes that improve the lives of children and families and communities. And we provide that reference into one of the appendixes. So then the last step after you develop your program, because that sounds really easy, is to develop your stakeholder engagement and outreach plan to market your equity program. So the first step with that is to identify and engage your internal and external stakeholders. So your internal could be yourselves, the entire city, any departments, and then external could be the citizens, any specific community. And I found a pretty good resource. It's from the Victoria State Government Stakeholders Engagement Plan, and it actually has like a step-by-step. It's kind of like a toolkit. Kind of like here's how you identify, here's how you engage, here's how you implement, actually communicating to yourselves and to the community. I also found a pretty good reference with but it actually provides a step-by-step guide with actually communicating equity with stakeholders. And it does say, like, here's how you engage your internal stakeholders, which is like all hands, emails, and meetings and bulletins, and maybe even having a steering group, like with a lead champion. I don't know, maybe the city manager might be too of a high person, but maybe they could, be your steering group committee. And then also for external stakeholders, you could conduct open houses and public meetings and other forums that you guys are obviously very good at in Alexandria to at least communicate, here's our equity program, and here's how you guys can, refer to any of our websites or communications. And that's it.
So lastly, so you see this bottom arrow here, from identify equity problems all the way to defining an equity program. We have all those previous recommendations that we offered. So just to refresh your memory about some of the ones that we've offered from our, I think it was 2014 summer and fall reports, and also there was one from 2015. Summer 2015, and some specifically that could allow, all of those related to cultural competence, but those could easily convey, those same initiatives could easily convey to your equity issue. So for implementing now, we had recommended in the past to develop and codify cultural competence policy, and also there's an existing linguistics policy that we think could be implemented and enforced that DCHS has that could work toward your equity issue that you have. And also in the fall report, we had recommended recruiting an equity officer to integrate the cultural competence into the agency. And CPAP also recommended several other resources to obtain additional short and long-term staffing. So after your performance gaps are identified, we've mentioned that you need to train your staff, obviously, but the summer and fall reports also they gave a specific structure for how to structure a training program, and also listed a bunch of programs that are already out there that you might be able to do a quick fix on, at least get people started and learn about and start thinking about the mindset of equity. And then after the staff are trained and policies are in place and everything, then you want to stand up an entire program. That's way down the line, but also let me see which report that was. From fall and summer of 2014, we came up with different performance indicators that you can use, not just for cultural competence, but I think that a lot of those same indicators you could use for your equity initiatives. But they also had this, the city's community indicators task force. I don't know if you're familiar with that, but they've listed a lot of measures that you could use as your performance indicators to determine how well you're doing with the equity initiative. And then again, developing an outreach plan and expanding maybe the membership of the CLC advisory committee to include people outside the DCHS world. And then the implementation plan, we just recommended, Virginia Tech just recommended, okay, always look at short-term solution, just a phased approach instead of just, complete on, just tip your, feet in the water a little bit and see how people react to certain things before you go full-fledged in implementation, which I'm sure you already know that. But I mean, just wanted to refresh your memory about some things that I think could easily apply, not just to CLC, but also to the equity program. So I think that covers everything that we had in the report. We'd like to just open it up for discussion or any questions, or did I miss anything, Dr. Hickok? Okay. So I'm going to turn off the video. Oh, sure, absolutely.
Just respond in
Sure.
general about the quality of the report and your approach.
Sure.
Is that okay?
Yeah.
Okay.
Do you want to talk from the?
Oh, I guess I could. Because I just want to go on record in terms of our satisfaction with the. But I just want to go on record related to the work that you've done in this report. And again, we've had a long and positive history. And I would say the approach that you all took really was exemplary. From the very beginning, the questions that you start to ask really demonstrate that you understood we needed to do more thinking in order to get a good product. And you pressed us to say, what are you really talking about? What are you trying to achieve? What exists? So sometimes that's a hard conversation with a client to say, this isn't fully formed. but you also framed out how we could think more fully about it. So that was very helpful to us. It wasn't just questioning us, it was saying, here's how you could think more thoroughly. Then in addition, really walking through an approach that is actionable, that's reasonable. Throughout, I think you were looking for ways that we could actually implement something, thinking about the concepts related to the toolkits, what's proven, what's what's worked elsewhere, and thinking again about our identity as an organization, what might we be able to do? So I think, again, reflecting back, trying to understand the context within which we are working and trying to give us something that we can actually be successful at. And then I think the concept of how do we actually achieve these things? Because frequently we get good ideas, and how do you really operationalize those things? That's been one of our most significant challenges within the department. And again, I think you've tried to lay out what would be a reasonable approach, and how do we really connect with others to ensure that these things happen. The concept of the stakeholder engagement, and really how do we bring others in to be invested in what we're doing, but also for accountability is very important. So I know I just wanted to say, you guys did a beautiful job, and we'll have a good conversation after we turn off the but I just want to say thank you very much, and thank you to you, Tom, once again. Thanks.
That's a nice add-on for them to
Thanks so
move
much.
forward. Thank you so much.